Welcome to the Chad G Ortho OT podcast. I'm your host, Chad Guerrero. I'm an orthopedic occupational therapist, strength and conditioning coach, sports trainer, and I hold over 40 specialty certifications in manual therapy, orthopedics, and sports medicine. On this podcast, we will discuss everything orthopedic therapy, sports medicine, and more. If you're a therapist, health and fitness professional, or someone just wanting to learn more about the orthopedic and sports medicine world, then this is a podcast for you. Let's get started. Before we get started, I want to let you know that if you have an interesting case or topic that you want me to discuss, head over to my website, Chad G Ortho OT, go down to the Contact Me section, fill out that form, and let me know what you have going on or what topic that you want me to talk about on an upcoming episode. Thanks so much. Welcome to another episode of the Chad G Ortho OT podcast. I'm your host, Chad Guerrero, and today we're going to talk about a crick in the neck. I mean, a lot of us have suffered with this. You go to bed one night, you wake up the next morning, bam, the neck's sore. You can't turn your head, neck. It's stiff. It's, aching. And we're taking anti-inflammatories and putting heat on it and all that, trying to stretch it. And it just, doesn't really get better. And a lot of times it will get better, within a day, maybe a few days, kind of works itself out, so to speak. And so if it goes on longer than that, and I'll kind of discuss what you should do in that case, but it really should be okay within a few days in most cases. But this is something that you can do to kind of speed up the process, right? So basically what's going on, a lot of times it's just an irritation to one of the nerve roots in the cervical spine, or the facet joints in the cervical spine. And so that just becomes irritated. And there's a lot of sensors around our, cervical spine area. And it becomes irritated for whatever reason, a little pressure at night, head turn a certain way, whatever. And that can cause muscles to spasm and become tight and just compressive. And, then you start to kind of, emit this pain, right, from these little areas of trigger points or whatever you want to call them, areas of hypersensitivity of muscle. And, a lot of times as our brain kind of calms down, it relaxes and releases and you can go on about your life. But, in some situations, it continues to occur and it continues to go on. And I'll tell you the things based off of my experience that just don't really work all that well. Or I guess I should say, if they're going to work, then they're going to work. And, it should have worked within a day or so. And it should not still be like a week later, a month later, 2 months later, you're still trying to treat this. If so, you're doing the wrong thing, right? So, using the heat and all that and the stretches, all of us who try to stretch that out and try to move our head and neck. And if you're doing that and it's not getting better, then actually what you should do, and again, in my experience, if that's going to get better, it would have gotten better and you wouldn't be seeing me. But by the time that you get to me, it's been going on for a little bit, right? And so something that you can try are isometric contractions, and I've talked about these on several videos that I've done. And I actually will have a video that's coming out. It may be out by the time this podcast is out. I don't know. It'll be on my website, Chad G Ortho OT. It's also on YouTube, Chad G Ortho OT. It's on my Facebook, same thing, Chad G Ortho OT on Facebook, or Guerrero Rehabilitation on Facebook, TikTok, Instagram, I'm on, all of this stuff. So you can go to my website and there's links to everything. But you can do these isometrics, which are just in very low effort, not a lot of effort. You're not like trying to push really hard with this, but these slight isometrics that you can do that are very effective. Also, another technique that I like to use is like a movement and mobilization together of the joints and tissue. So that's usually very effective. And there's a way that you can do that at home with yourself with like a towel or a pillowcase works really well. And so that will be demonstrated on the video as well. And because what you're trying to do with this is contract the muscles and relax the muscles, contract the muscles, relax the muscles, to let the brain know, hey, this is they're clicking on, they're clicking off, they're clicking on, they're clicking off. And that's normal and it's okay, right? It's a threat-free situation. So the brain can, relax this tissue and release this tissue that's holding so tightly and send this pain signal because, the tissue, the muscle, everything gets tight. And that causes more compression at the cervical spine, at the facet joints, at that area. And that basically the vertebrae is held up by two facet joints on the back and then the disc in the middle and the front. And, that kind of occurs through most of the joints in our spine, but not all of them. Not the upper one, it doesn't occur there. But in most of them, this does occur. And they just become hypersensitive and irritable, and we got to calm it down, right? And I always tell my patients, I actually told somebody this today. I said, sometimes with the brain or body with different musculoskeletal issues, it's kind of like if you've got a horse or a cat, dog, whatever it is, it's kind of skittish, right? And it won't let you pet it. And you ease up to it, you give it a little food, you get close to it. Maybe it takes a few days before you can even really get close and touch it. And then eventually you get to where you can kind of touch it. And then it goes on to like you can pet it and it's fine. It's not on edge. It doesn't feel like it's going to be hurt, this kind of a thing. So our brain works the same way. So by desensitizing this area, by contracting these muscles and relaxing, it can do that very thing. It's very effective. Again, if stretching and heat was going to work, it was going to work initially. Okay. I mean, and there's all other techniques. I don't care what you use, but in most cases, you're trying to desensitize the body or desensitize the brain, whether you're doing scraping techniques or myofascial cupping or just regular massage or joint manipulations or mobilizations or electric stimulation or dry needling or whatever it is. None of these are all like the magic thing that works. Every person's different, and every combination of things should be different for every person. So if you're going in somewhere and they're doing the same thing that they've been doing on every single person, unless they have some kind of magic formula that I'm not aware of, that usually does not work. You have to kind of see how the person feels and what works for them, because some things will work, for some people, but not everything works for everybody. It's like something's going to work, but you don't know what that is. So I always tell folks, my students and all that I've had, don't make this into like cookie cutter treatment. Just look, you're just going to kind of see, how it is with each individual patient and kind of go from there. So I will check the video out. That video will be, like I said, uploaded maybe before this comes out. I don't really know. But it will be titled maybe Crick in the Neck or something like that, which I have a couple of other videos or a few other videos on that. I just don't know. I don't think that I've demonstrated the movement mobilization stuff with a pillowcase and all that, and the isometrics. I've talked about isometrics before with neck pain, which is I love isometric contractions for neck pain. But I don't think I've had one that's specific to the quote unquote crick in the neck, Anyway, so that is the crick in the neck, and like I said, check the video out, see if you find it helpful, and I hope that again this information helps you. Like I said, if it's going on for longer than, I maybe give it a week, right? If it's going on past a week, you probably want to get something done about it. Go to a manual therapist or somebody, or whoever it is, OT, PT, whatever you use, massage therapist, whoever, and have this addressed. So thanks so much for watching, thanks so much for listening, guys. I do appreciate you so very much, all the support, and you guys have an awesome day. This podcast is brought to you by Guerrero Rehabilitation, setting the bar for rehabilitative and sports medicine care.